afternoon, everyone. And again, thank you for joining us. You are vital partners in helping us get our public health message out to the community. So thank you. To update our COVID-19 reporting, we have 112 total cases. That's up 2 since yesterday, and thankfully there are no new deaths. We have 72 who have recovered. 32 of our cases are epi-linked, and other demographics about these can be found on our COVID-19 website. Today we are pleased to announce, as you saw in our press release yesterday, the change in requirement for the public to access community drive-through testing sites. Testing is now open to anyone who thinks they may have been infected by COVID-19. You no longer have to have a provider's referral or even have symptoms to get tested. However, you still will need an appointment. And that appointment is so all your paperwork can be done before you get there, and there's little waiting time for you when you arrive. Appointments can be made through our health department for testing that is done at the Bonnie Shire site, and the number to call to make your own appointment is 209-8393. Between the time that you are tested and when you get your result, you should presume that you are positive. Return straight home, self-isolate until you get your result. Test results will usually return in 24 to 48 hours. If your result is positive, the health department will contact you and advise you of next steps and help coordinate care. And for this reason, it is vitally important that you give us correct contact information when you make your appointment. If your test is negative, then you should continue to practice the same social distancing and everyday actions you have to prevent COVID-19. We hope that opening our testing site up to everyone will help those who do not have health insurance, a private health care provider, or financial means to get tested. We also hope it helps those who think they are infected or give them some peace of mind one way or the other. And lastly, we hope this helps us to detect more cases if they are out there, detect them earlier, and take necessary steps to quarantine and prevent the spread of the virus throughout our community. Thank you. And now I will take questions that you have.
It's going to be from Elizabeth. Go ahead.
Yes, so my question is, will you guys have any tests for antibodies that show people who've been infected in the past? And if not, why? And is there anyone that this, isn't appropriate for or shouldn't, what questions, I guess, are people going to get answered at this facility?
We are not doing antibody testing right now. There's a lot of information about antibody testing that has not been thoroughly decided in the scientific community. Principally, how long your immunity lasts. Does your immunity certainly even protect you for sure against reinfection? And there are a lot of variety of different antibody testing type of machinery out there. So no, we are not doing antibody testing yet.
Sarah Grace.
Do you have any information on how many false negatives or what the false negative rate has been in Hamilton County? Have there been any examples of somebody getting tested twice and having it the second time?
I don't have any information on that right now.
Callie Starnes.
Hey, Becky, thanks for taking my questions. I had two, if you don't mind. We received a statement late this afternoon from a spokesperson for SIMPA with some concerns saying that they actually are not a testing site. So I was hoping you could help us clarify that for our viewers as to what the relationship is with that organization. That's my first question. If it's okay, I'd like to ask one more after you answer.
Sure. Well, SIMPA is an important partner with us. SIMPA agreed early on that if people called our hotline seeking testing and they didn't have a physician to evaluate them, that we could refer them to SIMPA. Their physicians would see them and refer them if it was appropriate. Yesterday, there was some misinformation about the difference between our partners that are helping to evaluate people with symptoms and our partners that are actually doing testing. So Clinica Medicus is doing testing. They will evaluate and do testing, but the other partners right now are just evaluating people's symptoms to see if they need testing or if they need care.
Thank you for clarifying that. My second question is just in your professional opinion, Mayor Burke joined the other major metropolitan mayors in announcing a task force today that will ultimately be charged with reopening the economy. I just wondered what, if any, role you all there at the health department will play, and do you feel as though now is the time to be talking about reopening Chattanooga, specifically our economy?
Well, I think we all know that our economy can't stay closed forever. So I think always discussing the when that happens is appropriate. I would assume that the committee that is looking at that would ask us for data on cases, looking at our EpiCurve, the scientific kind of things that we are tracking on a daily basis.
Thank you.
Jake Chapman.
Hey Becky, so I know that the Bonnie Shire location is the testing site, but with this now, you guys are not taking referrals anymore, but you still have to make an appointment. Are there discussions of adding another site or extending the hours at Bonnie Shire?
Yes,
the capability?
Yes, we are thinking that we will add an additional site as we roll through the next weekend. Not this weekend, but the next weekend. We're hoping to add an additional site, and we hope to have that announcement to you really early next week.
Gotcha. And I guess I'm going to follow up with, for me, we asked last week about, counties surrounding us not even asking for referral when they started the drive-through testing. I was just curious as to why Hamilton County waited till now to do no more referrals for testing.
Well, it's always been about capacity in our system, supplies, and trying to ensure that we had a method to test people that were symptomatic, that were the most high-risk people, to ensure they got tested. So that was our situation. But yesterday, we realized that we felt very comfortable that we had capacity enough in our system that we could both accommodate physicians that are referring us for testing and then take the general public that want testing also.
Gotcha. Okay.
Latricia.
Hi, Becky. Can you talk about how the state's announcement yesterday played into your decision to start testing people without symptoms? And then I also wanted to ask about the Vanderbilt study that came out today about the transmission rate across the state.
The governor's announcement yesterday, we had been planning to participate in that. But the tornadoes that happened Sunday night changed our plans. We really weren't able to fulfill all the planning that needed to have weekend sites this weekend. So that was a big disappointment to us. And then with surrounding counties being able to do that, that's one of the reasons that really helped us decide that we had the capacity to start today. allowing people to come without referrals. So, I mean, we wanted to participate with the governor's surge in testing. We planned on it, but the tornadoes really are just set us back a week from being able to do that.
Thanks. And then the second part of the question, have you seen the Vanderbilt study that came out today talking about the transmission rate across the state being better, but that Hamilton County's transmission rate is still higher compared to some of the other places like Nashville and other regions?
I have not seen that.
Okay. Would we be able to send that to you guys and maybe get a comment about that after you've read over it?
Absolutely.
Perfect. Thank you.
Elizabeth, do you have another one?
I do. I was just going to ask, how important is it for us to be testing asymptomatic people? And I mean, what does this mean for our community and our ability to fight the virus and restart our lives?
Well, I think since the pandemic began, I mean, there's been lots of unknowns, and one of the big unknowns is how much spread of the virus is being triggered by people that are asymptomatic. And I'm sure you've read a lot, and there's certainly mixed opinions about that. But clearly, there are people that are asymptomatic that have the virus. So this will give us an opportunity as a community to see how many asymptomatics that we might have out there. And clearly, even if you are asymptomatic, we will want to quarantine you also, or isolate you, excuse me.
And so if somebody came in, say, this week and wasn't positive, I mean, do you just, is there any caution you have against people just coming in just indefinitely for regular testing?
Well, regular testing shouldn't be necessary. On the other hand, we don't want people to walk in or drive in and have a test and think, well, I don't have it, and then they can change anything about their social distancing. So the test is a point in time. You don't have it today. That could change with your exposure. So clearly we want people to understand that. But we do want to make sure people realize that we have testing available if they have exposures or if they start to develop symptoms. We want to have community testing readily available.
Jake, do you have one more?
Yeah, just to go off Elizabeth's a little bit about caution of testing. So in that case, is there a fear that, or do you guys have enough testing now that you're going to let people in without referrals when it comes to testing?
Yes. People can self-refer themselves.
Latricia, do you have another one?
No, sorry, I didn't mean to still have my hand up.
Okay, I think that's it.
Okay. We appreciate you all helping us, as I said, get out our public health message, and thank you very much.
This meeting